Our next speaker will deal with the LEAP program, probably the best known social protection system or program in Ghana. That is the Livelihood Empowerment Against Poverty program. Thank you very much.
Thank you. First of all, we want to thank you for giving us this opportunity to share our experiences from Ghana. And the way I want to approach this is to give a very short video that we are making to put up in the public view to actually educate the public on the program. It's still being developed, but in order not to catch the eye of the timekeeper, which is a very brief, just about 2.5 minutes video to actually explain, give a bird's eye view of what the LEAP program is. And thereafter, we will look at the achievements, impact, challenges, and the way forward. So let's look at it. Yeah, so briefly, that is what LEAP is. Trying to contribute to poverty reduction in Ghana. Now, what are some of the impacts and challenges that we have had? And to be able to do that, and also base our arguments on evidence-based issues to engage the public and also with policymakers, LEAP made it a principal or a critical part of it to engage in impact assessment. And these are some of the highlights of the results we have had from our impact assessment. The organizations, yes, what we did in collaboration with other partners is to try and look at the impact of the program on the local economy And this was done through the local economy-wide impact evaluation of Ghana's livelihood empowerment against poverty, which will form part of this discussion. We have also had qualitative research and analysis of the economic impact of the program as part of some of the programs going on in the sub-Saharan African countries. And also, we have had a quantitative studies by the University of Ghana in collaboration with the University of North Carolina. And we have all this information, and you can have it on the link that we have over there if you want to look at it critically. So the methodologies that was used in the quantitative study is what we also have over there. It was a collaboration between the Yale University and then the University of Ghana Institute of Statistical, Social, and Economic Research. The approach they used was the longitudinal propensity score matching and then the diff and diff approach, that is difference in difference approach. To be able to actually look at the LEAP households in comparison with other households that have similar characteristics and then attribute whatever happens as an impact of LEAP. Right, so LEAP, as we have already seen, is a cash transfer program for the poorest families in Ghana. What these studies have told us are that LEAP is reaching the poorest families in Ghana. It has the greatest potential to reach the poorest families in Ghana as compared to most of the poverty reduction strategies being implemented in Ghana. It targets poor families and also poor communities. These are some of the issues that have been raised in the various reports in the areas of education, health, basic food needs, and then also on the local economy. LEAP has increased secondary school enrollment by 7 percentage points. Grade repetition has reduced by 10 percentage points, and children missing school has also reduced by 11 percentage points. In primary school, grade repetition has reduced by 10 percentage points, missing school in a week reduced by 5 percentage points, and absenteeism by 8 percentage points. The lessons are that LEAP is helping to reduce dropouts and learning, and also increasing enrollment in secondary and primary schools. On health, we already have an ongoing national health insurance scheme that has exemption component. And overall, 90% of LEAP households are benefiting from the exemptions in the national health insurance scheme. Children between 6 and 17 years have increased by 16 percentage points, and children under 5, 34 percentage points. The studies also indicated that likelihood for children to be ill has also reduced by 5 percentage points. In terms of basic food, food insecurity, self-perceived food insecurity reduced by 25 percentage points. And there is more variation of food in the households. Consumption and irregular payments and then bulk purchases have contributed to this. In terms of production, loans and credit, loan repayment has increased by 23 percentage points, savings by 11 percentage points. Labor and investment. Beneficiary families work 9 days more, particularly, and then in smaller families, they work 13 days more. In other words, there is that argument that cash transfers contribute to laziness and things like that, but the studies have observed otherwise. Some of the beneficiaries have started small businesses. They have put up temporary tables where they sell sweets, biscuits, matches, and also trying to produce some of our local cookies, kose, kuli kuli, and things like that are being sold in their communities. Oh, fine, all right. On the local economy, what the studies have observed is that for each 1 Ghana cedi that is transferred to beneficiary households, the local economy increases by 2.5 Ghana cedis. In other words, the impact of the transfer on the local economy exceeds the amount transferred. Non-LEAP families are also benefiting from the transfers. There are challenges, a number of them. We have irregular payments to beneficiary households. Majority of our funds come from the Ghana government budget allocation. And there are a number of times where we have had challenges in getting our releases for regular payments to the households. We also have inadequate operational capacity. Even though government staff are highly skilled, but because of the freeze on employment, we tend to have difficulties in getting the people we need to support the operations. Dr. Edu mentioned about scale-up. Our coverage is currently very low. Out of 10 of the poorest families in Ghana, only 1 is a LEAP beneficiary. There are also weak linkages with other poverty reduction interventions. Winnie was talking about a number of social protection interventions in Ghana. Similarly, we also do have. But apart from the National Health Insurance program, we have very weak linkages with other interventions in the country. And then also limited knowledge of the program by beneficiary households. We're talking about governance, accountability, and stuff like that. But we realize that the beneficiary households and their communities have very limited knowledge about the program. So that is the picture and what the studies that we have had tell us. Quite a number of green, but still we do have a number of red areas to deal with. LEAP is a simple idea. The simple idea is changing the lives of the poorest families in Ghana, but the full potential of the program is yet to be achieved. We need to address these challenges by strengthening the system's approach. Now, they are now in bits and pieces, and if we really want to put them together, this is how it should be, like a complete house with kitchen, bedrooms, a hall, and everything. Thank you very much for your attention.
Thank you very much, Mr. Ofori Addo. I'm sure that, like me, the audience is impressed that your pictures indeed told us a thousand tales